I don't know how to say this, but lately it burns when I pee.
Thank you for choosing Essentialyze. How can I help you today?
I have a rash. I think I got it from the gym.
I think I have pink eye.
I have a cold sore that just won't go away.
I think I have a sinus infection. I'm congested and have a wild headache.
My doctor's office is closed and I need a refill on my medication. I've been feeling really depressed and I don't know how to get out of it.
I have a sore throat. My back has been killing me.
I just need someone to talk to.
Well, you've logged on to the right place. I'm really glad you reached out. Let's get you the care you need.
Essentialyze is here to help. Whether it's physical symptoms or emotional support, we've got you covered on your schedule. No insurance? No problem. Affordable, accessible, real care that relates to you. Screenshot the website and schedule a visit today.
Okay. All right. Hi, my name is Chandele and I work with Essentialyze Healthcare. We are a telehealth service that offers mental health services as well as urgent care services virtually. Some of the things that we service are urinary tract infections, cold sores, your everyday common cold, back pain, minor urgent care needs. We provide these services so that people don't have to go to the ER, don't have to stand in long lines at the urgent care, and you can do this from the comfort of your home and have accessibility, affordability, and quality care at your convenience.
Oh, yeah, I like that.
Okay. So basically, you would go on the website and you'd schedule an appointment, an online appointment. We would confirm your appointment, and then that's it. You log on, we send you a link, and that is the end of the whole process of scheduling an appointment. We see you. The visits are usually within 10 minutes because these are minor issues that people may have. And that's it. It's very simple. It's as simple as scheduling an appointment and following up with the provider.
Okay.
At your convenience.
I get it. So what's the benefits of virtual instead of walking into a doctor's office?
Okay, so I believe that living in New York, we're very busy. We're always on the run, we're always picking up and going. No one has time to go to an ER, no one has time to go to an urgent care. Ideally, being at home, dealing with your kids, dealing with your family life, then making a quick call or a visit virtually is the easiest thing to do to make sure that you are still taking care of yourself, your family, and most importantly, your health.
Can you answer why do you think black people don't like to go to the doctor?
So I don't necessarily think it's that black people don't like to go to the doctor. I think black men don't like to go to the doctor, but I feel like black people probably don't go to the doctor enough. Number one, because they don't trust doctors. Number two, who do we trust, right? I think that the issue is more so that we are busy. We've got a lot going on and we try to put that as last on our list. I think that as a community, we don't prioritize our health because we put bills, we put family, we put work, we put everything before our health. And that's the main reason why black people don't go to the hospital or don't see their doctors regularly, which inevitably later on turns into an even bigger issue because had we gone, we would be able to have preventative care, right? We would know when something happens and it's not a big deal as opposed to now it's gone too far, we've ignored the signs and the symptoms for too long and now we have issues, bigger issues than we should have had we prioritized our health.
You took something small and made it bigger.
Correct.
Okay. So with this being said now, the virtual, if they feel scared to go to the doctor or they don't feel comfortable to go to the doctor, this could be something that could help them out to go check a doctor or speak to a doctor.
Absolutely, because if you just have a simple conversation with a provider from the comfort of your home that feels not stressful, It would then give you enough information to know the severity of your concern or your complaint. If you have a stomach ache, but now you've had the stomach ache for a few months, or you feel like now you have diarrhea, or now you have nausea and vomiting, or whatever the case may be, talking to someone who would then say to you, well, let's talk about your family history. Does cancer run in your family? What do you eat? What is your lifestyle? Tell me what you had for breakfast, lunch, and dinner. These are conversations that are pretty minimal, but can still get you to a point of knowing, well, you know what, either I need to get a colonoscopy to make sure that I don't have colon cancer, which seems to be very prevalent nowadays amongst our community, or something as simple as maybe I just have irregular bowel habits and maybe I need to eat less fiber or more fiber. But we don't know these things unless we ask.
Okay, well, I'm gonna ask you a question as far as, okay, this is virtual, and so if I was sick or if I was feeling away, should I do the virtual first or should I see the doctor first?
Okay, so it really depends on the severity of your symptoms, right? So if you feel like you're having a heart attack, most likely you should not go to an urgent care. You should go over to an ER so that they can have or use the correct equipment that they would need to make sure that that's not what you're experiencing. If this is something that does not feel life-threatening, then yes, a virtual visit would be ideal.
All right, what kind of doctors do y'all have?
So we have primary care providers, we have nurse practitioners, we have doctors, and that's basically it, all internal medicine. So they know a little bit of everything about the body. It's not a specialty.
Oh, okay. So these doctors just know, so they give you like prescription and things like that?
Yes, absolutely. You get prescriptions for whatever ailments it is that you're experiencing.
Okay. Like, what kind of other sickness do y'all, like, can you break down the stuff that y'all, what's the top things that y'all provide and help with?
Okay, so usually we see a lot of stomach pains that are not life-threatening, meaning maybe you just had a crab boil and now you're like, oh, my stomach feels away, and you have not stopped going to the bathroom. Maybe you are having a sinus infection, flu-like symptoms, back pain. Maybe you need a refill on your medication because your doctor's office is closed and you're not able to reach them. What else do we offer? We offer things for fevers, gout, just minor ailments that we deal with. Sometimes patients have tooth infections and they'll call because they need an antibiotic. So it pretty much varies, and like I said, it's mostly for things that are non-urgent, not life-threatening, in other words.
Okay. Once a person have a virtual meeting or a conversation with you, what are the next procedures after that?
So
it all depends on what they're going through, what the procedures.
yeah, so if you call for a specific ailment, I'll obviously ask you a bunch of questions about your medical history, and then afterwards I'll send your medication to your local pharmacy. You pick it up and that's it. There's nothing more to it.
This sounds real simple. Just don't sound like it's crazy. It sounds like real simple, straight to the point.
Straight to the point. It's a flat rate of.
Like it's no middleman. That's
No.
what makes sense. It's no
Exactly.
middleman.
No.
It's no middleman. It's just straight to the you, doctor,
And then the pharmacy.
pharmacy.
That's
Yeah,
it.
that's all I'm going. And so it's this you, the urgent care, the doctors, and the pharmacy.
That's it. You schedule your appointment, you see a provider, most likely a nurse practitioner. Afterwards, they send your medication to the pharmacy, and that's it. And then they will tell you to follow up with your primary care provider that knows you and sees you regularly. Early prevention is key. That's it. The sooner you find out that something is not okay, the better it is for you, the better it is for the people who love you. Sometimes we're just in a rush. We're New Yorkers, we're busy, we're always on the go, we always got something going on in our minds. So for me personally, a lot of the preventative care that I do for myself, I do it for my kid. I do it so that if there's something wrong with me genetically, it may be wrong with her down the line. So I want to know what's good with my kid. I want to prepare her for anything that I can basically stop her from getting or having to deal with in the future if I'm vigilant about it. And I think that that's probably what's best for our community as far as how we should look at it. That we're not doing it for us, we're doing it for our family. We're doing it for the people that care about us, the people who want us around. That's why I think it's important that we go to the hospitals. I think that's why it's important that we see our providers regularly so that they know us, we know them, and if there's anything wrong, it can be spotted immediately. No, not natural at all. So the reason why Essentialyze was created was so that we hit places that I find are often overlooked. I'm from Flatbush, East Flatbush all day. And so for me, it's important to come back home. It's important for me to be like, where my people at and how can I help? What are the needs? I try to be as engaged as I can, and it's not just Flatbush, obviously, right? It's whomever needs the service, and I think that everybody can use the service. There's no human that is always perfectly healthy. Sometimes we get sick. We have animals. Our animals get sick. It's normal to be sick. The goal is that we have access to healthcare, and it's not a mission to get it. You don't have to give your firstborn to get it. It's just an online scheduling system that you say, okay, I want to see the provider at 7 o'clock. You see the provider at 7 o'clock, you tell them your concern, you get your medication or whatever information they can give you to help you with your health and the betterment of that. And this is for all humans, for all people, but starting with Flatbush.
One more thing.
Okay. Again, my name is Chandele Wrong, and I am with Essentialyze Health. Thank you, We Are Flatbush, for coming out to see me and to have real conversations about real things like health and the importance of health in our community. Health is wealth.